Welcome back to OMFS Essentials, concise knowledge for the modern maxillofacial surgeon. In this episode, we'll review two important practical topics: ligatures, used for hemostasis and vessel control, and suture removal, the final step in wound management. Ligatures. A ligature, or tie, is a strand of suture material used to occlude the lumen of a blood vessel, effectively stopping bleeding or closing a structure to prevent leakage. Ligatures are essential for achieving hemostasis and securing tissues during surgery. There are two main types. 1. Free tie. A free tie is a simple strand of suture handed directly to the surgeon or assistant. A hemostat is first applied to the vessel end, and the tie is looped beneath the clamp. The knot is tightened carefully by hand or with forceps, avoiding damage from instruments. As the knot is secured, the assistant gradually releases the clamp to allow the ligature to seat properly around the vessel. This method is straightforward and effective for small and superficial vessels. 2. Stick tie, or transfixation or suture ligature. A stick tie is a ligature attached to a needle. The needle is passed through tissue adjacent to the vessel before the suture is tied, anchoring it securely. This technique is especially useful for large or deep vessels where a free tie may slip. By passing the suture through nearby tissue, the ligature becomes anchored, ensuring that even under tension, the knot stays firmly in place. Stick ties are particularly valuable in major vessel ligation and pedicle control. Suture removal. Suture removal marks the final step of wound care, and although it seems simple, it must be done aseptically and gently to prevent infection or trauma to new tissue. Preparation. The site is first cleaned with antiseptic, removing any dried serum or debris. Hydrogen peroxide may be used to soften crusted material. Technique. Using sterile thumb forceps, lift one end of the suture slightly above the surface. With sterile scissors, cut the suture loop close to the skin at the point where it enters the tissue. Gently pull the suture through the opposite side, ensuring that only the buried portion passes through the tissue. The outer surface segment must never be dragged inside, as it may carry contaminants into deeper layers. This technique minimizes the risk of infection and preserves the healing epithelium. General guidelines for suture removal. Always follow aseptic technique and use sterile instruments. Remove sutures before the epithelial layer grows deeply into the dermis to avoid tract formation and scarring. After removal, apply sterile strips or wound tape to support the wound edges and prevent scar widening. Timing depends on location and tension. For face and neck, 3 to 5 days. For other skin areas, 5 to 8 days. For retention sutures, 10 to 14 days. In many cases, alternate sutures are removed first, allowing partial support during final healing. Ligatures and suture removal may appear routine, but their precision directly influences hemostasis, healing, and scar quality. Every maxillofacial surgeon must perform these steps with care from the first knot to the final cut. You've been listening to OMFS Essentials. Subscribe and stay tuned for the next episode, and as always, keep mastering the essentials.